No, gynecomastia, for people who don't understand, is generally two different tissue types in the male chest. One is fat, usually diet-resistant fat, which is the last area to shrink when they lose weight. And the other is glandular tissue, which is this rubbery, dense breast tissue. It very commonly develops during puberty in men and most often goes away, but sometimes doesn't. And there can be a genetic component to this as well. So thankfully, the surgical correction for this is relatively straightforward. I generally do just a small incision just at the bottom of the areola, very, very narrow. And through that, I'll do liposuction to remove the fat, and I'll do direct glandular tissue resection to remove the excess glandular tissue. And that usually will flatten and masculinize the chest. And then, often the areolas might be a little large, and those usually will get smaller as the tissue is removed. When I tell you some of the most impacted patients I've seen from surgery are some of my gynecomastia surgery patients. I remember I had one patient who was as an adult, he was in his 30s. He had essentially B-cup female-looking breasts to the point where when I posted before and after on Instagram, I got flagged because they thought I was posting a nude female chest. And he literally had never gone shirtless, never gone to the pool, never gone to the beach. And we kind of joked because after the surgery, we said he kind of got an allergy to shirts. He was going shirtless everywhere because he was just so excited to kind of live freely and not worry about his chest again. So when I tell you gynecomastia is one of the most powerful procedures that we do in terms of confidence building, that's it. Because men don't tend to get a lot, or definitely not as many surgeries as women do, but usually it's liposuction. But gynecomastia is probably the biggest one that I do and probably the most impactful.